Assalamu alaikum. This is a presentation for medical students by Dr. Mumtaz Ahmad Umar, and today's topic is pure tone audiometry, or most commonly known as PTA. So this is the part 1 in which we will see the definition, the hearing loss and its types, understand the principles of pure tone audiometry, and learn the interpretation of different types of audiograms. And in the second part, we'll see the specific audiograms in specific diseases. So by definition, pure tone audiometry or PTA is the most common audiological test. So this is then audiological investigation. So pure tone audiometry is the most common audiological test to assess the hearing level of an individual to a specific sound. That sound is in the form of a pure tone, and pure tone is a single frequency sound. So hearing level of an individual to a specific sound at different frequencies. In introduction, the most important thing to note is that it is a subjective test, meaning that it is test dependent. I mean the patient dependent test. Whenever that patient responds to that particular sound, that result will be plotted in the form of graph. So this is patient dependent test. It is a subjective test. It measures the hearing sensitivity of a person to specific pure tone sounds of varying intensities at different frequencies. It is a measure of a threshold of hearing by air conduction and bone conduction. So sound travels in two forms, in the form of air conduction and bone conduction. It helps to diagnose the type and degree of hearing loss. And then the results are plotted on a graph, and that graph is known as audiogram. It is not audiograph or pure tone audiograph, it is audiogram. So audiometry machine is calibrated in such a way that 20 decibel level on the audiogram, will we see later, is taken as a normal. 0 is not the normal, 20 decibel is the normal. And bone conduction graph will always remain above the air conduction graph. So we'll see that later on. The frequencies which are tested, so for air conduction thresholds, they are tested from 125, 250, 500,000, 2000, 4000 and 8000 Hz, while the bone conduction is tested at 250, 500,000, 2000 and 4000 Hz. The most important thing to note are the speech frequencies. So these speech frequencies, they are very important to note, as they are from 500, 1000 and 2000 Hz. These speech frequencies are those frequencies at which we usually conversate and hear at these frequencies, because other frequencies from above 2000 becomes the high frequency sounds. So our normal routine conversation is between these frequencies. So any effect in these frequencies, the patient will feel the hearing problem more. Secondly, whenever we are interpreting the results, we always take the mean of these three speech frequencies, and then we can tell which type of hearing loss and degree of hearing loss on the basis of that mean. So this is a picture of an audiogram. No graph is plotted yet, but as I mentioned, 20 decibel. Okay, let me first tell you, in the x-axis it is the frequencies from 125 to 8000, and in the y-axis is the intensity level starting from -10, -20 up till 120, but 20 is the basic threshold level for a normal hearing person. Now another important point to note when we are describing the audiogram. So audiogram is a piece of paper. So when we are describing anything which is less than 20, we will not say less, but we will say as we are describing the paper, and on paper anything is up, it will become above, and anything down will become below. So above 20 is normal, like this. Whereas when we see it, it is not the above 10, 0, it is coming under the 20. But when we are describing the audiogram, then this part, upper part become above. So don't confuse in that. So above 20 is the normal, and below 20, 30, 40, 50, 60, this will be the diseased part. So whenever we are filling, mention the date, the name, and test by this you can put. So hearing loss is of three types basically: conductive hearing loss, sensorineural hearing loss, and the mixed hearing loss. So this is the diagrammatic presentation: conductive, mixed, sensorineural. The sensorineural is further divided into the sensory part, which is the cochlear, and the neural part, which is the retrocochlear, involving the eighth nerve. And now again that neural or retrocochlear, it can be peripheral or the central meaning the brain on the central pathways. So this is the picture of an ear: the outer ear up till the eardrum and the middle ear up till the stapes foot plate. Any problem in this region, it will mark the conductive hearing loss. The air conduction sound, it travels from the pinna into the external auditory canal, then it vibrates the tympanic membrane. These vibrations will travel via the ossicles, and then it will pass through the cochlea to the eighth nerve. So air conduction is a whole process of hearing. I mean, the air conduction, it will involve all part of the normal hearing mechanism. Whereas for the bone conduction, it will directly stimulate the cochlea, then that vibration will transfer and move further from cochlea to the eighth nerve and to the auditory cortex. So for bone conduction, this external and middle part, which are the parts of the conduction, they are spared. So we'll see that what I was saying. The air conduction, it is a natural way of hearing, involving all parts of ear via the external and middle ear to the cochlea and eighth cranial nerve. It is tested with the help of headphones. Air conduction is complete test of hearing as passing through the natural pathway of hearing via all parts of the ear and into the eighth nerve. While bone conduction, it is a test for the alternative pathway of hearing as it is directly stimulating the cochlea with the help of a bone vibrator. So bone conduction is incomplete test of hearing as it is directly stimulating cochlea and eighth nerve while skipping the outer and the middle ear as the sound bypasses these two structures. So in certain cases, if air conduction is not working, hearing can be restored via special devices which will directly stimulate the cochlea. So students, for conductive hearing loss, both the air conduction and bone conduction, what will happen? The air conduction will be poor, as we have mentioned that in conductive hearing loss the problem lies from pinna to the footplate of stapes. So air conduction will be poor, but bone conduction, which is the cochlear reserve or the stimulation of cochlea, that is not affected, so that will be normal. Whereas in sensorineural hearing loss, now if we see that for air conduction, the air conduction is passing through here, then it is vibrating the tympanic membrane and then through the ossicles So up till here in sensorineural hearing loss, the effect is not there, but it has to pass through the cochlea. But cochlea is affected in sensorineural hearing loss. So air conduction will be poor. Whereas for the bone conduction, as it is directly stimulating the bone is bone vibration, it is affecting the cochlea and then to the eighth nerve. So as cochlea is affected in sensorineural hearing loss, so this bone conduction, it will also be affected and it will be poor. So in sensorineural hearing loss, both air conduction and bone conduction will be poor. Masking. Now, what is masking? It is an important step while performing pure tone audiometry. Masking is a process of giving noise to the non-test ear through headphones. It is a white band noise. It is used to prevent from detecting sound in the non-test ear. That sound we are testing for the testing ear. So to prevent it detecting from the non-test ear, and especially in bone conduction where sound can be transmitted through the skull bone to the non-test ear. Why masking is given? As already mentioned, so sound presented to one ear, which is the test ear, can sometimes be heard by the other ear, which is a non-test ear, especially when there is large difference in hearing thresholds between the two ears in ear conduction. And since the sound, it travels through the bones of the skull, which is known as cross hearing. So to prevent the cross hearing, uh, masking is always carried out in bone conduction. Masking, it prevents false response and ensures accurate measurement of hearing thresholds in the testing ear. So when masking is done, if the difference in air conduction, in cases of air conduction, if the difference in hearing thresholds of the two ears is more than 40 decibel, and as I already said, whenever bone conduction is performed, it should always be done with masking the non-test ear. So now coming forward, we'll look for what are the equipment needed to perform the pure tone audiometry. So obviously, yes, we should have an audiometer, then headphones for air conduction, bone vibrator for bone conduction, and a soundproof booth or room. What is an audiometer? An audiometer is a device which produces pure tones, the intensity of which can be increased or decreased in 5 decibel steps or more. So these are two different types of audiometer. This is the new audiometer device with much more multi-functions and a screen attached on it, while this is, though screen is there, but it's very small and it's a old audiometer, but both will serve the purpose. Procedure: the patient is seated in a soundproof room or booth, headphones for the air conduction, and a bone oscillator or vibrator is applied for bone conduction. Pure tones presented are tested at various frequencies from 250 to 8000 Hz as already mentioned, and intensities varied to determine the threshold. The lowest sound heard 50% of the time will be marked that particular intensity on that specific frequency as a hearing threshold. So this is a soundproof booth, and these are the headphones and bone vibrator here. So the patient is seated and headphones are attached. The colors are marked right for red or red for right side and blue is for the left side. Now in this picture, this bone vibrator is applied. Headphones are applied on both sides at one time, but bone vibrator is applied only on one side. So once this ear is tested, then this bone vibrator will be applied to the other ear, and then that ear will be tested. So as in this excuse me. So as in this patient, uh, the bone vibrator, it is on the left side. So the right side earphones, it will be producing the masking, and patient will be asked to press this button whenever he will hear the sound on the testing side. So whenever, as already mentioned in the previous slide, 50% of the times if the patient presses the button at specific frequency, like for example at 500 frequency, if the patient presses this button at 30 decibel 50% of the time, then that 30 decibel is the hearing threshold at that particular frequency, which is 500 hertz. So in this way, all the frequencies which already mentioned will be tested. So these are the different symbols which are used in the audiogram. As already mentioned, red colors are marked for the right side and blue colors are marked for the left side. So air conduction unmasked is circle on the right and cross or X on the left. Masking, triangle and square. Bone conduction unmasked is the smaller brackets and masked will be the bigger brackets. And if there is no response whatsoever, a downward arrow will be marked, showing that there is no response. So these are the degrees of hearing loss. This chart shows the degree of hearing loss. As already said, up till 20 it is normal hearing, 20 to 40 will be mild, 40 to 55 is moderate, 55 to 70 will be moderately severe, 70 to 90 will be severe, and above 90 is profound hearing loss. Interpretation of the audiogram. As already mentioned, the normal thresholds are equal or less than 20 decibel hearing loss. So if any patient's air conduction will be at 20 decibel or below, so that will be normal. So in those cases, if a detector or the examiner is not performing bone conduction, it will be okay. As I already said, that the bone conduction graph is always above the air conduction graph, and up till 20 is normal. So if up till 20 air conduction is coming in the normal range, so bone conduction will always be normal. But in cases of conductive hearing loss, as already said, air conduction will be poor, but bone conduction will be normal. Sensorineural, both air conduction and bone conduction will be poor. And in mixed hearing loss, again both air conduction and bone conduction will be poor, showing there is a sensorineural element, and the air-bone gap, which should be greater than 15 decibel, which is a one point in detection of the conductive hearing loss on audiogram. So that point, if AB gap is greater than 15, equal or greater than 15, then it will be conductive element also. So when both elements are present, it will be mixed hearing loss. So now interpreting a normal audiogram, as already said, if it is at or above 20 decibel, the air and the air conduction graph, so for both right and left, air conduction graph is above 20 decibel, so there is no need to perform bone conduction. If you perform bone conduction, then it's okay, but if you don't perform bone conduction, then it will again be okay. So the amount of intensity that has to be raised above the normal level is the measure of degree of hearing impairment at that frequency. We'll come to that in the next slide. So bone conduction, as I already mentioned, always remain above air conduction, and both AC and BC will be within normal range, and there will be flat line across all frequencies, showing that it is a normal audiogram. So for conductive hearing loss, as already mentioned, bone conduction is above 20, which is in the normal range, and air conduction is below 20, which is the abnormal range. And the air bone gap, it is more than 15 decibel. Now how we come to know that it is 15 decibel or more? If you remember what I have said earlier, we have to take the mean of these three frequencies. Okay, we have to take the mean of these three frequencies: 500, 1000 and 2000 hertz. Sorry, not 4000, 2000 hertz. These three frequencies. Okay, so if we see for bone conduction, it is 5, 5 and 0. So 10 divided by 3. So it is around 3. For air conduction, it is 45, 45, 35 and 30. So it will be 105, and 105 divided by 3 is around 36, 37. So the gap, both will you minus that 37, 38, whatever it comes. So you have to minus, and after subtracting, the gap is more than 15 decibel. So this way we come to know that the gap is more than 15 decibel. So it will be pure conductive hearing loss. Now there are many different causes you can find in the book. Some important or commonly presenting one are the impacted wax, then the eustachian tube dysfunction, otitis media and its different types like otitis media with diffusion, chronic otitis media, acute suppurative otitis media, acute otitis media, chronic suppurative otitis media, and so on and so forth, otosclerosis, ossicular discontinuity. So these are different types. Now for sensorineural, okay, again I will emphasize when you are detecting or interpreting an audiogram. Uh, so first thing is the type of hearing loss. So for to determine the type, two things has to be memorized or remembered. One, the bone conduction will be above 20 in the normal range, and air conduction will be below 20 in abnormal range. And the second important point, the air bone gap should be 15 decibel or more. While for sensorineural hearing loss, both air conduction and bone conduction graph should be below 20, and the air bone gap should be less than 15 decibel. So these are the two important points, again for conductive also and for sensorineural, to detect or interpret on audiogram. Again, some important causes are presbycusis, Meniere's disease, noise-induced hearing loss, acoustic neuroma. For mixed hearing loss, again both air conduction and bone conduction graphs, they should lie below 20 decibel, and the gap should be more than 15 decibel. These are the mixed hearing loss is commonly present in long-standing cases of chronic suppurative otitis media, because it will now affecting the nerves and the cochlea, and in cochlear type of otosclerosis also. So there are certain indications and clinical applications while performing the proton audiometry. Yes, first and the most important is to detect the hearing loss, its type and its degree. So its PTA, it helps differentiate different types of hearing loss, and it determines the degree of hearing loss. It can be used as a guide management for certain diseases, whether medical, surgical or rehabilitative. In surgical, if you are performing laryngoplasty or tympanoplasty, ossiculoplasty, or laryngotomy with grommets, so the pure tone audiometry improvement will indicate the success of that procedure. Again, screening in high risk patients like noise exposure, ototoxic drugs, they then routinely it has to be carried out in those patients who are dealing with high noise jobs or equipment, like those on the aeroplane, in railway stations, in factories. So regular or annual audiometric evaluation is mandatory. It also helps to see recovery in cases of sudden sensorineural hearing loss. The records can be kept for future reference. It is an essential part for prescribing the hearing aid and to find the degree of handicap for medico-legal purposes. So in the end, the summary is PTA is the gold standard hearing test. It assesses ear and bone conduction. It differentiates between conductive, sensorineural, and mixed hearing loss and provides the degree of hearing loss. And interpretation of audiogram is crucial for diagnosis, and it different diseases show characteristic patterns which we will see in part 2 of the presentation. Thank you.